we have been providing some snapshots on the importance of fit-for-purpose regulations in this challenging field. But when it comes to regulations, there's a logic assumption that needs to be clearly stated. Higher levels of awareness go in hand with long-term or robust regulatory frameworks. But there are some reasons why we are not there yet. And here we can see some examples that help to perpetuate how this complex issue is managed from a regulatory aspect. I think it is worth pointing out that mental health problems remain unaccounted on the list of occupational diseases for most of the countries in the world. We've recently seen how burnout has been included in the latest revision of the International Classification of Diseases of the WHO, the World Health Organization, as an occupational phenomenon, not classified as a medical condition. I also think that both Elise and Lindsay will probably agree that these risks have been traditionally considered by health and safety practitioners as soft, as practitioners have always been trained and educated to tackle physical risk. And there's still much to do to control physical occupational hazards, a reason why resourcing from a regulatory perspective is still an ongoing issue. To this respect, there's still a lack of understanding of how to consider mental health issues and support those with pre-existing mental health conditions and those who have mental health conditions resulting from work-related psychosocial factors. And of course, this significantly differs based on levels of general socio-cultural tolerance, attitudes, and workplace attitudes, in particular, stereotypes and public perceptions of the issue in different countries. And in order to exemplify these challenges at a policy level, the International Labour Organization recently published a thorough report, Workplace Stress, a Collective Challenge. And one particular section of the report analyzed the obstacles for the development of initiatives in workplace stress and psychosocial risks. And as you'll be able to see on the graphic on the left side, barriers for the implementation of initiatives in workplace stress and psychosocial risk, as shown in the graphic on your right side of the screen. These were geographically classified, including Africa, the Americas, Arab states, and Asia and Pacific, and Europe and Central regions. As we can see from the slide, the following obstacles and barriers were top rated based on aggregated data at the country level. The lack of political will to develop and implement initiatives was considered a major issue. The culture of compensation rather than prevention. This is basically laws not aimed at prevention, but focusing on compensation. A lack of awareness and of trained and qualified professionals, and a lack of data as well being reported and reliable statistics. And we know that a lack of appropriate expertise is a factor that has been already been mentioned throughout the webinar. And we really hope some of the learnings from this webinar could be most helpful to health and safety practitioners. On a similar basis, businesses have gone through challenging barriers. To this respect, we need to be conscious that the current approach is not working. And I think that we also need to be mindful that this subject is not going to go away. It will remain within the business. So in relation to some of the different challenges identified, organizations have found it easier to focus on the physical element than on its psychological, and invest in initiatives without measuring the effectiveness or impact of those. Embedding psychosocial risk management into business as usual is still a challenge that organizations will need to face. And on the same basis that we have governance structures in place for managing physical and process safety risks, we need to address the same focus to the less visible risks. Elisa, I guess you found a recent example that demonstrates this complexity in relation to the possibilities for recognition of work-related mental disease or disorder as an occupational disease. Is that right?
Yes, Ivan, indeed. In Switzerland, a parliamentary initiative for job burnout to be recognized as an occupational disease got rejected last February by the National Social Security Commission. The reason behind that was because the Commission considered that it was not possible to establish a definite link between the symptoms and the occupation. It is also considered that the prevention program already put in place by the private economy are substantial and there was no need for further actions.